The skeleton can be divided into two major groups of bones, the axial skeleton and the appendicular skeleton. The appendicular skeleton is composed of the limbs and the bones that hold them to the axial skeleton. The shoulder girdle is composed of the clavicle and the scapula. These hold the arm to the axial skeleton. The pelvic girdle is made of the pelvis. The pelvis is composed of three fused bones, the ilium, the ischium, and the pubis. The bones of the arm are the humerus, the radius and the ulna, the carpals, the metacarpals, and the phalanges. And in the leg we have the femur, the patella, the tibia, the fibula, the tarsals, the metatarsals, and the phalanges. The shoulder girdle is composed of the clavicle or collarbone and the scapula or the shoulder blade. This is where the humerus or the upper arm bone will be attached to the axial skeleton. On the scapula there are several landmarks. There is a prominent spine on the posterior side of the scapula. Above the spine is a depression known as the supraspinous fossa, and below is the infraspinous fossa. As we look at the anterior surface of the scapula, there is the depression known as the subscapular fossa, and a notch called the suprascapular notch. As we look at this side view of the scapula, we have the supraspinous fossa, the infraspinous fossa, and the subscapular fossa. This is the acromion process. Here we have the coracoid process, and this is the glenoid cavity. Here is the scapula. This is a bone you need to know the right and the left on. If you are looking at someone's back, your right and their right will be the same. So since this spinous process is on the back, or the posterior surface of the scapula, if you are looking at this, you're going to be looking at the back of the scapula. It's like you're looking at someone from the back. Since the arm has to attach here, this one has to be the left and this one has to be the right scapula. The clavicle has an acromial end. This is the part that's going to articulate with the acromial process on the scapula, and then we have the sternal end. This is the end that will articulate with the sternum. This end tends to be a little flatter, so you can think of the sternal end as being sort of like a stamp. Now here is another one of those C words. This is the conoid tubercle, right here on the clavicle. The upper arm bone is the humerus, and there are a number of landmarks on the humerus. First of all, the humerus has this rounded area known as the head. Here we have epicondyles. The ones on the outside are known as the lateral epicondyles, and the ones on the inside are known as the medial epicondyles. The deltoid tuberosity is partway down. This is where the deltoid muscle will be attached. And the capitulum is down here at the distal end of the humerus. It's a rounded, looks like the top of a head. The coronoid fossa is this depression, and this is on the anterior surface of the humerus. Here we have a spool-shaped structure known as the trochlea. All of these are involved in making the elbow joint. The greater tubercle is the large prominence that's opposite the head on the proximal end of the humerus. Next to it will be the lesser tubercle, which will be a smaller projection. In the elbow region at the distal end will be the olecranon fossa. This is a deep depression seen only on the posterior side. To determine whether the humerus is right or left, you use the trick of having the back of the bone facing you. You know that you're looking at the back of these two bones because you see the olecranon fossa, that deep depression here and here. The heads have to point toward the body, and so this has to be the left humerus, and this has to be the right humerus. This is the radius and the ulna. The radius has kind of a radiodial end on it. The ulna has a little U on it. Now on the radius, that point in your elbow is called the styloid process on the radius, and we have another one on the ulna that is also called the styloid process. Here is the radial tuberosity. It's on the radius up near the proximal end. And then we have the coronoid process. This will fit into the coronoid fossa on the humerus. Here we have the olecranon process. This will fit into the olecranal fossa on the humerus as well. And this is called the trochlear notch. This is where the trochlea from the humerus will fit. The hand is composed of three groups of bones. The bones of the digits are known as the phalanges. The bones of the palm of the hand are known as the metacarpals, and the wrist bones are known as the carpals. Now the fingers are simply numbered. We start at the thumb as 1, 2, 3, 4. So this would be the first metacarpal, second metacarpal, and so on. The phalanges are only named as proximal and distal, and we only have 2 phalanges in the thumb. We have 3 in each finger, so we have the proximal, the intermediate, and the distal. In the wrist, there are 3 bones you need to know. There are a total of 8 bones in the wrist, but 3 of them you need to be able to identify. The trapezium articulates with the first metacarpal. This is where the saddle joint is located. You have to remember that the trapezium is near the thumb. Then we have the scaphoid and the lunate. These are the 2 carpals that articulate with the radius and the ulna to make your wrist joint where you bend your wrist. Moving to the pelvic girdle, we have the pelvis here, and there are going to be rough spots on the coxal bones that are going to represent the sacroiliac joints. This is where the sacrum articulates with the pelvic bone. The iliac crest is this large prominent crest of bone, what you usually think as your hip bone. You can usually feel this through your skin. The pubic symphysis is where the 2 coxal bones are held together. This is a fibrocartilage joint. The acetabulum is the deep cup-shaped depression where the femur will articulate with the coxal bone. Acetabulum means vinegar cup. And then these 2 holes, the obturator foramen. Blood vessels and nerves go through these to get to the leg. And where the 2 bones join, we have the pubic arch. The coxal bone itself is 3 fused bones. We have the ilium, the ischium, and the pubis, but they fuse so completely that you really cannot tell them apart. The greater sciatic notch is this large notch here in the ilium part of the bone. The ischial spine is in the ischial part of the bone. It's a spinous projection. And underneath it, we have another notch that is known as the lesser sciatic notch. The ischial tuberosity is a rounded, roughened piece of bone. This is actually what you sit on. This is the part of the bone you sit on. You need to know the right and left coxal bone, and this is a little more challenging, but these ischial tuberosities point toward the back. So when you're looking at these ischial tuberosities, you have them on the correct sides. So this would be the back of the bone where you can see the ischial tuberosity. This would be a left, this would be a right. The patella, or the kneecap, is a sesamoid bone. It's embedded in the tendon of your knee. So it's right here in the front of your knee joint. The femur or thigh bone is the upper bone of the leg. The head is quite prominent on the femur, very rounded, very distinct, and you have a very distinct neck. The medial condyle is this rounded tuberosity here, and the medial epicondyle would be the projection of the bone to the side of the medial condyle. The lateral condyle would be the other one, the one on the outside, and so the lateral epicondyle would be the projection of bone on either side of the lateral condyle. The greater trochanter is this large ridge of bone at the top of the femur, and then the lesser trochanter you see better on the posterior view. You can see it just peeking around on the anterior view here. The gluteal tuberosity is going to be a projection on the bone. This is where the gluteal muscles attach to the femur. It may not be very prominent. You may only be able to feel it if you run your finger over the bone at this point. And this big deep notch that we see on the back is the intercondylar fossa or the intercondylar notch. It makes sense. It's between the 2 condyles. To tell the right and left femur, use the same trick of having the bone facing so you see the back. You know that this is the back because here's that deep intercondylar notch. The heads have to point toward the body, so here we have the right and here we have the left. The lower leg bones are the tibia and the fibula. The fibula is the smaller, more slender bone, and it is the more lateral bone. It is going to be on the outside. So you need to remember that the fibula is lateral. The lateral malleolus is that knot on your ankle that's on the outside, and it's on the fibula. The medial malleolus is the knot that's on the inside of your ankle, and it's on the tibia. This would be a right tibia. Here you're seeing it from the front, so you have to flip it and put it on the other side, but this medial malleolus has got to be pointing toward the middle of the body. The head of the fibula nestles up under the tibia here. We have the medial condyle on the tibia and the lateral condyle on the tibia. The fibula articulates with the lateral condyle. And then right here in front we have the tibial tuberosity. This is where the quadriceps muscles attach. The foot also has 3 major sets of bones: the phalanges, the metatarsals, and the tarsals. And just like with the hands, we start with the great toe or the big toe and go 1, 2, 3, 4. We have proximal, intermediate, and distal in all of the toes except the great toe, which only has a proximal and a distal phalange. These would be the metatarsals, numbered 1 through 5, and here are your tarsals. And there are 2 of these bones you need to know the names of. The talus is where the tibia and the fibula are going to articulate, and the calcaneus is your heel bone. There are differences in the male and female skeleton. Usually the bone is heavier in males simply because they tend to be larger. Also, the bone markings are typically more pronounced in males. They have heavier muscles, and that puts more stress on the bones at those places. If you can look at the pubic bone, in males the angle of the pubic arch is less than 90 degrees. In females it's greater than 90 degrees. The other thing is look at the sciatic notch. If your thumb fits in the sciatic notch and pretty much fills it up, that's a male skeleton. If your thumb has lots of space around it, that's a female. So looking at the pubic bones, you want to look at the sciatic notch, see if your thumb fits in there or not, and at the pubic arch. Judging from the pubic arch on this would be a male skeleton.